we will always play an important role in terms of helping people when they're sick. But there's also a role that we can play in improving overall community health. One of our guiding principles is that we are going to look at our communities through a health equity lens, which means that we look at our communities really recognizing the barriers individuals face in those communities as they try to access care and live their healthiest selves.
Good morning, how are you?
We try and help people that are needing resources that maybe don't know of what's available out in the community. We find them in the hospital if they're already admitted, or we find them in the ER. If we notice that they don't have a primary care physician or are having difficulty with covering medications, and that's why they keep coming to the emergency room for prescriptions.
I was having trouble getting my insulin and couldn't work and was taking chemo. And they helped me out with all of my supplies.
He didn't ask for it. We kind of told him that he was going to take it.
I had a doctor that I only saw once, and he wrote me up for insulin, and I went to get it at the pharmacy, and they wanted like $300 for it. And then I came here, and they tell me you can go to Walmart without a prescription and get it for like $20 or $25.
I've had patients that have no running water, that have no food, they have no heat, no electricity. Until you get those basic needs met, it's really hard to worry about whether or not you have medication for your blood pressure or for your diabetes because you're not eating anyway.
We reduced hospital readmissions and patients coming to the ER. Patients know they have a resource here.
It's changed my life. I mean, I'm a lot healthier than I was before I started coming.
We provided last year $864 million of charity care and community benefit, and that's outstanding, and it's something that we're proud of. But what we also want to look at is how can we best look at upstream? How could we take maybe some of those dollars that we spent in charity care and look at what ways could we prevent, delay, even reduce the number of inpatient admissions, look at reducing the number of visits to the ER. What can we do to keep someone healthier?
So we have our symptom cycle right here. Starts with poor sleep.
The folks that we are trying to help serve with this class are those who may suffer from any type of chronic condition, any type of chronic illness, or even loved ones of those who may suffer, as well as caregivers. We teach each person ways to problem solve their health conditions in order to improve their health. And also we teach them ways to manage their conditions. We do weekly action plans, and the class have a great opportunity at the beginning of each weekly class to report back on their action plans.
My action plan was to walk from my house to the corner store at least 4 times between.
And the great thing about this class is we learn how to manage our everyday life while dealing with this disease.
We are very serious about being data-driven and outcome-focused. And so any solutions that we look for have to respond to a true need in the community and has to have a strong evaluation component to it, because we have to be able to demonstrate that we're making a difference.
Deep breath. One more.
And addresses fear of falling in older adults. 10,000 adults turn 65 every day in the United States. And we're looking at a 50% increase in that age group over the next 15 years. So add to that at every second of every day in the United States, an older adult has a fall. That's billions of dollars in healthcare costs. It's a real concern.
And then switch. Switch.
When they first come in, they fill out a self-evaluation form, and it asks things like, do you feel like you can prepare yourself for a fall? Do you feel like you can get up if you fall down?
All right, here we go. Up and down.
So they answer those at the first of the class. Then we go through the 8-session class, and same things are asked at the end of the program. So really it's a self-evaluation, a self-growth.
We are required to do a community health needs assessment every 3 years. Our last one was completed in 2016, and we really have been acting on the findings from that report. By 2019, we will have a new report, and then we will be able to take action and move forward with the findings from that new report.
we're going to use our community health needs assessment to say, what does the data say? And more importantly is, what outcomes or goals are we trying to achieve together?
Partnerships are absolutely necessary in everything that we do in community health improvement. We are not going to become experts overnight in transportation issues or in housing issues or in food insecurity, but there are organizations out there in the community who are already doing work in those areas. We really have an opportunity to make a huge impact. We have to have those partners in place, and we have to have strong plans and really follow the data.
It's heartwarming to know that you can really make a difference and an impact on a person's life.